So in this video we are going to see the applied anatomy of the cervical spine. Now the anatomy of the cervical spine, it has 7 vertebrae from C1 to C7 and 8 nerve roots. But we are going to see the more applied anatomy. Now if we see the applied anatomy of the cervical spine has more mobility and less stability. Now cervical spine connects in the upper end the heavier head, and the lower end a more stable thoracic spine and the ribs. Now if you see cervical spine, functionally cervical spine is divided into 2 parts. So upper part is known as a cervicocephalic area or cervicocranial area, C0, C1 and C2, where C0 represents the occiput and the lower cervical region is called as a cervicobrachial area or a lower cervical spine. Now cervicocephalic or a cervicocranial area C0 to C2 shows connection between the cervical spine and the occiput. Injuries to this region have a potential of injuring brain, brainstem and spinal cord. Injuries to this area will lead to symptoms of headache, vertigo, fatigue, irritability, poor concentration, disturbances to the sympathetic nervous system, cognitive dysfunction, and even the cranial nerve dysfunction. Now we'll see the first articulation or C0, C1 or the atlanto-occipital joint. These are the uppermost 2 joints in the cervical spine. When there is a flexion allowed about 15 to 20 degrees, that is nodding, side flexion 10 degrees, but there is negligible rotation at C0, C1. Atlas has no vertebral body. Axis or the second cervical spine C2 has a vertebral body that is called as a odontoid process, or in other words dents. Now atlanto-occipital joints are ellipsoid joints. Now if you see this complex, the first articulation atlanto-occipital joint and second articulation is the atlanto-axial joints. These 2 articulations are the most complex articulation in the entire axial skeleton. Now anteriorly the atlanto-occipital joint is strengthened by the anterior longitudinal ligament. Posteriorly it's strengthened by the ligamentum flavum, and the tectorial membrane is a broad band that covers the dents of the second cervical vertebrae. Now there is one more ligament called as a alar ligament. Now alar ligament stabilizes or limits the flexion at a C0, C1 and limits the rotation at C1, C2. So in other words, alar ligament limits the flexion and the rotation at the atlanto-occipital joint, and rotation limits or stabilizes the rotation at the C1, C2 joint or atlanto-axial joint. Now atlanto-axial joint, if we see C1, C2, if you see that, this is the most mobile articulation in the entire spine, where flexion extension is allowed like 10 degrees, side flexion is 5 degrees, but rotation is 50 degrees approximately, 50 at atlanto-axial joint. Now odontoid process of C2 acts as a pivot for rotation. Now middle joint is classified as a trochoid joint or trochoidal joint by the pivot, and a lateral atlanto-axial joints are facet joints. These are plain joints in nature. Main supporting ligament for this is a transverse ligament. Now transverse ligament holds the dents of the second cervical vertebra along the arch of the atlas anteriorly. Now the transverse ligament is prone to get weak or get ruptured in a rheumatoid arthritis. There are other 2 projections of a transverse ligament. The superior projection goes and attaches to the occiput. The inferior projection goes downward and attaches to the axis. This form a cross. So in other words, it is known as a cruciform ligament of atlas. So in the coming video we are going to continue the applied anatomy in the cervical spine. Thank you.